and welcome. My name is Adrienne Jameson. I'm the Executive Director for Community Action of Southern Indiana. And we're here today to talk about the impact of federal funding in Southern Indiana. I have Becky Romans, the Executive Director for Hope Southern Indiana, Kate Brackett, Chief Operating Officer for Family Scholar House, and Pamela Clark, the Director of Health Programs at Community Action of Southern Indiana. And the reason we're here is there's been so much discussion around the impact of federal funding on local programs and nonprofits over the past several months. And we wanted to take this opportunity to zoom in and really localize the discussion to talk about what it means for us here in our counties that we serve. So to provide some context, according to the Urban Institute, nonprofits in Indiana have $3.3 billion in federal grants to facilitate throughout the state of Indiana for various purposes. More locally, that breaks down to $8.7 million in Harrison County, $17.7 million in Floyd County, $26.2 million in Jefferson County, and $46.5 million in Clark County. Last month, we heard from leaders from LifeSpring Health Systems, Ohio Valley Opportunities, and Southern Indiana Works, and what those dollars do for their programs. And today we'll hear from you on what these dollars do for your programs and in the communities that you serve. So if we can just start with a round of introductions, share a little bit about your organization and the services that you provide. And Kate, I'll start with you.
Great. Thank you so much. I'm excited to be here and have this discussion. My name's Kate Brackett. I'm the Chief Operating Officer with Family Scholar House. We serve student parents and young adults who've previously been in state's care as they pursue post-secondary education. We're really here for the wraparound services that take away some of the barriers that previously have prevented them from entering post-secondary education and ultimately career track employment. I've been with Family Scholar House since 2011, and so we've seen a lot of growth and a lot of lives changed, and excited to be here.
Yes, and I love that you highlighted your wraparound services. When I think of Family Scholar House, I literally think of a hug. Like you are hugging people and like helping them physically on their journey. So I love that. Becky, would you mind?
Yeah, Becky Romans, Executive Director of Hope Southern Indiana, and we've been serving the Southern Indiana community for just over 60 years. We just had our 60-year anniversary last year, and we have a large food pantry. We have an emergency services case management program. And really, the goals of that program are to get people in housing or keep people housed by paying utility bills is often a way that we do that. A lot of people don't know if people are in subsidized housing and they lose utilities. It can be grounds for termination of housing. So we do everything we can to keep people in housing and any other emergency needs that they have. We have a large retired senior volunteer program, our RSVP program, with over 850 senior volunteers serving nonprofits in the Southern Indiana community. And we just do a whole lot of classes that help people learn to thrive, a lot of children's programming. So we just try to meet the need, whatever that is in our community.
Excellent. Thank you so much. And Pam, tell us about what you do.
Hi, my name is Pamela Clark. I'm the Minority Health Initiative Director. Been in public health for about 28 years. I am funded through the Indiana Minority Health Coalition out of Indianapolis. Our mission for the program is to eliminate health disparities through advocacy, through outreach, access to care, research dollars, but we cannot do any of that without our community partners. So our programs are prevention programs, for example, diabetes self-management programs. We also have presentations and we go out in the community and provide screenings, and education is the big piece in referrals.
And that is one program area within Community Action of Southern Indiana, but it's a big one and it has a lot of partnership aspects to it. So real quickly, tell me, I know we all have slightly different service areas and intended to put that in our introductions, but Community Action of Southern Indiana is in Clark, Floyd, and Harrison counties. Becky, tell us your region.
So we serve Floyd, Clark, Harrison, Scott, and Jefferson counties in Indiana.
Okay. And Kate, yours is unique. Tell us about yours.
Yes, so we're in Louisville and the surrounding counties, and then also Southern Indiana. through the Family Scholar House program. And then through our FSH Works component, we serve individuals in 48 states as of last year.
Excellent.
Okay.
Excellent.
And I serve Clark, Floyd, and Harrison counties.
Got all three of those.
Mhm.
All right. So we're here talking about federal funding. Funding for organizations of the size we have today is complicated, right? So it's sometimes hard to say what is what. But can you give us an idea of what percentage of your programming as an organization is federally funded or federally impacted? Whoever feels most comfortable.
So we're directly funded. About 11% of our RSVP program, or our 11% of our total budget is federal funding. So about 40% of our RSVP program. We have a veterans program that's about also 40% funded by federal funding. And then about 40% of the food we get comes in through Dare to Care, and so that is directly affected by federal funding.
Mhm.
Thank you.
Yes, so we have Dare to Care as well, so that is directly affected. For Family Scholar House, we're about 20% of our budget. For Family, which is our parent company, it's about 42%. And that comes a lot from FSH Works because we have AmeriCorps programs that we have. But more so with Family Scholar House, we also have our housing component that relies heavily on federal funding, subsidized, and vouchers that are also a challenge right now.
Okay, so community action, over 90% of Cassie's programs are federally funded. And we also receive state funding and from local foundations and donors. And as you know, we have Head Start, weatherization, IDA, and housing voucher programs, just to name a few.
So, Becky, I heard you mention it, and I want to dive a little deeper. The Retired Senior Volunteer Program, RSVP, which is the greatest acronym you could get for a program, and it's federally funded. Tell us more about that. What benefits does it offer to participants, and how does it increase the capacity of host organizations to work with those volunteers?
So we don't talk about this enough, but seniors in our community who are retired often feel a loss of a sense of purpose. So they're really prone to isolation and depression. So the RSVP program directly addresses their need to feel needed. We've all seen the research that shows that people give back because it feels good. And so we help these seniors by giving them a life purpose. And we help the community by making direct connections, building relationships between community nonprofits and the seniors in our community. So I rarely go into a nonprofit where one of our seniors isn't volunteering, usually a whole bunch of them. But our senior volunteers saved the community over $2.7 million that they would have paid in staff last year. So we're really excited, not just about the fact that we're giving our seniors a sense of purpose, but even more about the fact that we're saving our community dollars that they would have to spend on hiring staff and paying benefits if it weren't for these highly skilled senior volunteers. I had a senior volunteer. I had no idea. I had a senior volunteer working our front desk, and I was working on a volunteer handbook. And she said, "Well, I don't know if you knew this, but I used to be a hospital." I can't remember exactly what her role was, but basically she did a lot of HR work in the hospital. And she said, "I love writing manuals." And so
Woo!
these are highly skilled volunteers who can do all kinds of things. In fact, I just had one help me rewrite our employee volunteer manual. So yeah,
That's
good stuff.
incredible. And we have hosted those volunteers, and they're just a huge asset. Kate, have you used them at Family Scholar House? Have you had those volunteers before?
We are starting with a senior AmeriCorps program coming up in the new year. We've not had that specific, but we rely. I've resonated so much because we rely so much on volunteers for our program and of all ages.
Absolutely. So Kate, you kind of painted the picture when we first started talking that Family Scholar House has a really diverse funding model. It's complex and includes federal, state, local, individually contributed resources. tell me about how you work to leverage all of those different types of funding to support your ambitious goals. I know you have a big project going on right now at the Ivy Tech campus. Like, how do those things all come together to create impact?
Yes. So we value the diversity of our donors and funders and really inviting individuals to the table to be able to support our mission. So finding ways to really utilize those funding to support, for instance, the Sellersburg campus that's coming to life next month, which has been a long road, but it would not have been possible without all of the different players that and investors supporting our mission. And so we think it's really important because no one entity can do it all. Just like whether it's a nonprofit or funders, we really don't want to duplicate services or utilize more funding than is needed. And so we really try to look for unique pathways and innovative ways to get new donors and new resources so that we are being very good stewards of the funding that we get.
Mm-hmm.
Okay.
And Cassie and Family Scholar House share a very similar mission to end the cycle of poverty. If you look at it from just a language perspective, you might think, oh, this is duplicative or we're doing the same kinds of things. But our work is very different. How do you like to work with other organizations to make sure that you're having the most impact?
Yes, definitely. Uh, a time that comes to mind is when I attended your all's recent open house a few months ago and was learning about the different resources that you all have and the experts in your all's field, whether it's the financial education or the energy efficiency and those different things. And I was texting our staff immediately saying, oh, this is a great referral. We need to make sure it's going both ways so that our participants can utilize your all services and vice versa. So we are very big on knowing the community resources and making sure we're providing referrals for our participants because we don't want to reinvent the wheel. There's no one organization that can do it all. And so we very much do a lot of referrals. And so because a lot of people come to us and they may need additional financial education or they may need interested in home ownership. And while we provide some basic levels, we really rely on community partners such as Cassie that have individuals that are in that work every day and have those resources to share. So I think it definitely takes all of the nonprofits and all of the different entities to serve our families and ensure they have the best opportunities to towards self-sufficiency and providing for their families.
I think that's such a great point. The need is immense. There's plenty of work to go around, and we do each have just a specific area of expertise and pool of resources that we can use to move the needle on those needs. Pam, collaboration is a big part of public health. That's kind of the core of how it
Yes.
works. Tell me about how your partnerships work together in the public health world. How are you leveraging the different types of resources that are available to all the different partners?
Well, as I said at the beginning, there is no way we can do our jobs in public health without community partners. And true collaboration involves supporting one another and just not sharing resources. But we look for those when we come together, our community partners, for example, the Black Barbershop that has been I think it's been going for 9 years now. When we come together, we identify that Black males are not getting screened, they're not going to the doctor. So we look for those individual organizations like our local hospitals and the ones, our local hospitals, our businesses, our social services, what can they bring to the table to connect our individuals, those men, to services? How can we talk to them about the importance of getting your screenings? I'm not surprised that I hear walking around with high blood pressure is normal. And we have to tell them, oh, it is not normal to walk around with high blood pressure. So I appreciate our nurses taking the time out to talk to them one on one and tell them, if you need a provider, if you can go to this clinic, LifeSpring has a clinic, the Family Health Center. So we start talking about those resources. But once you start having that conversation, you realize that maybe they could use a counselor or a therapist. And then we bring in another partner that's the subject matter expert to bring in and talk to them about where they can go for those services, or maybe it's someone in their families. So we have signature events. We have our back to school. We have our doula for Black Maternal Health Week. We have doulas that come in and address maternal health. So I could go on, guys, all day and talk about how wonderful our partners are, but how I call it, we stay in each other's lane. We make sure we come together to address those issues. It's never about us. It's about addressing the needs of the community.
hmm It really is a collaborative effort with lots of resources pouring in from different places. How do we measure the return on investment when we talk about public health?
When we talk about public health, it's about quality of life and how we can improve individuals and how we can redirect them to stop smoking and what resources are out there. We also collect stories about how we have impacted their lives, or they've went to the family health center and how the family health center provided them with their diabetes medication, their insulin, or their whatever their need is. With my program, I'm able to report out the demographics as we do collect information. We also collect feedback, pre-post tests with our intervention programs. Um, we also, when we talk about social determinants of health, we're talking about where we live, work, and play. It is so important that we collect that data and also share it with our funders. We invite them to the events. We have them sit down and we talk about before I receive funding from Caesars for the Black Barbershop, they meet with me and we talk about, I go over the report, how many were screened, how many had high blood pressure. So we provide that data to our funders and also the community.
Mhm. And not to put too fine a point on it, but there are lots of proposed changes to Medicaid and healthcare access in general for the communities that we serve. If those programs are changed or diminished, what might the impact be for Southern Indiana families?
Adrian, just that question alone makes me nervous. It really does, because I just had a conversation at the New Albany's Library this afternoon regarding that. And a lot of people, a lot of families, a lot of women and children, families with children with adult that have disabilities, or seniors that are in nursing homes, it's going to impact them. Um, they're not going to be going to get their screenings. They're not going to be going to the doctor. And years ago, I don't know if you remember, but about 20 years ago, Medicaid wanted their members to make sure that they picked a provider so they wouldn't use the emergency rooms. We don't want to go back to that. We don't want to go back to 20 years of doing that. So, to fast forward, I feel that we are going to have to come together with Anthem, with CareSource, just to name a few, and talk about what is the message after the dust settles. How do we make sure no one falls between the cracks and make sure that they continue their coverage? Because they're going to change. I'm not going to talk about it on this, but there are going to be a lot of changes. But education is going to be the key to make sure that folks continue to have coverage under Medicaid. And we also don't forget about, there are some seniors that have dual coverage, Medicaid and Medicare. So it's going to require us to have listening sessions and to get folks to the table. But we're very fortunate to have Head Start here, because we'll be able to partner with them on some of their events and get that word out and get the message out. But it's important, again, to bring those community partners together that have the right message.
Mhm. Making sure we're all sharing the right information,
Mhm.
focus on education, completely agree. And Becky, kind of along the same lines, the other major benefit being discussed at the national level right now is the Supplemental Nutrition Assistance Program, SNAP. How might access to SNAP or changes to access potentially impact the work that you do around food access? Like, what does your demand look like now, and what do you anticipate it to look like in the future?
So I really resonated with what Pam was saying about just that question alone being something that's devastating to even think about. We're already seeing a great increase in food insecurity. The price of everything is going up, and families who are currently on SNAP are already subsidizing their food needs with food pantries, including ourselves. So we've seen over the last few months, really since October, but more drastically over the last few months, already those in need of food really grow in numbers. And in addition, we've seen really for the first time a lot of new families coming in and accessing our services. And these are families, it was 142 families last month who came in for the very first time, never having had to ask for food assistance before, and they were ashamed and embarrassed at the fact that they needed this kind of support. So we are talking about the deepest SNAP cuts ever in history. And when we think about the need that we already have, so we served 590 families in April, which was a record number for us. We expect in June, based on the first couple of weeks, that we're going to serve over 1,000 families. So without these cuts, the needs are growing just so fast. So we can't even imagine what the need will look like if there are cuts to SNAP. It seems a rushed decision, and it seems the wrong time to do it because there are so many increasing needs already.
Mhm. Yeah, we operate a much smaller food pantry here out of our Claysburg facility, and that's happening today. And as Pam shared, that opens at five o'clock, and there were folks lined up starting at 4, trying to beat the weather. So we have also seen a significant growth in the number of folks seeking resources. And to Pam's earlier point, when we think about how we're going to adapt to new people who need these resources, we're going to have to do a lot more education for folks who don't know how to find the resources that other people are currently utilizing. Another kind of unique challenge when we talk about taking these big federal problems and taking them local is that Southern Indiana is a unique mix of urban development. We're right across the river from Louisville, but we also have some really vast rural communities as well. What makes local nonprofits like ours uniquely qualified to serve these diverse communities? And Kate, maybe if you'll start, because you have a perspective with pretty broad across the country.
Yes, I think the most important thing, at least from the what we view, is really understanding and getting community buy-in. So understanding the participants, understanding the need and what individuals on the ground are seeing every day. And so not just assuming we know or what works in one place it can be replicated everywhere because that's certainly not the case. And so the need, while it's growing everywhere, it looks also very different everywhere, and the access to resources looks really different. So where public transportation and different things are very vibrant in one place, it's more desolate somewhere else. And so understanding what barriers our participants are facing based on where they live and what they are experiencing and what they're doing, I think is the biggest thing. So understanding that everything can't be replicated, and even though, from our Sellersburg campus on the real close to Ivy Tech, and they're a great partner, and we're learning a lot from the faculty there, the Urals team at Cassie. Louisville is not that far, but in some ways it feels very far. And so understanding the community is the biggest part.
Becky, do you have anything you'd like to add there?
Yeah, I would agree so much with Kate that the importance of understanding the community and even more so the importance of understanding the transportation challenges. So we do have a community that's spread out all over the place. And so I talked a little bit about how the numbers of people that we're serving are growing so quickly. And I can't help but think every day, those are the people who have transportation to get here. But what about those families that don't? So I think being uniquely able to serve the community and understanding the community are almost two different things. So I think we understand the community, but I think we still need to do more to reach those rural areas.
Mhm.
I agree. I worked in Louisville for 9 years at the American Cancer Society, and I worked downtown. And my role as a community rep was to serve the West End of Louisville. When I think about the work that I did for many years prior to going there, I think in Southern Indiana has such a strong collaborative infrastructure. We do have transportation issues. I know that they've cut back on, TARC has cut back on some of their routes. So that has become an issue. But the Indiana Department of Health has certified community health workers. So we have some wonderful community health workers throughout Southern Indiana that I partner with. But I think we just work well together. Not that they do not in level with the health department, because I've partnered with them in James Brown Cancer Center. So I'm able uh, to bring some of those resources to some of the families here. I know there was a time that Indiana folks only went to Clark Memorial, but now they're going to, Norton's, and they're venturing out to specialists, and that we do not have over here. And that leads me into mental health services, because a lot of folks were looking during COVID, were looking for um, a minority, a Black therapist, and we do not have any of here. We have the two that we have, I know, work in Louisville. So, that also is something that we probably need to address, and to see if we can partner more with some of those folks in Louisville to bring them over in Indiana.
Thank you for that.
Hmm.
I feel like through this whole conversation, we've just been zooming in, zooming in, zooming in. And so Becky and Kate, I'm going to make it really personal for a minute. Um, in addition to the potential loss of critical support programs for our neighbors and our community at large, I know a lot of organizations, Cassie included, are thinking about how they may be impacted as an employer if there's significant disruptions to funding. Cassie employs 80 individuals across our programs, and in administrative roles, many of who are experts in their fields. And our largest employee group is associated with one of our federally funded programs, Head Start. How are you thinking about this as an employer? What type of roles are held by your staff, and how many staff do you have?
So we have 4 full-time staff and 8 part-time staff. And the majority of those staff work under programs that are federally funded. These are highly professional staff, but they're also highly dedicated staff, and they're stretched thin and they're stressed and they're fighting burnout. They're working hard. And so facing the challenges of them realizing that with federal cuts, there may be job loss or the need for us to cut back in staff positions is devastating to staff who are already stretched thin. So it's devastating to think about having to lose any of our staff members to federal cuts.
Kate, how about you?
So for Family Scholar House, we have 17 full-time staff across our 5, soon to be 6 campuses, and then 2 part-time staff. And so I echo everything that Becky says. As I think most nonprofits can attest to, we have some of the most brilliant, hardworking, compassionate, dedicated to service and advocacy. And so, in looking at, they're already spread very thin. And so the idea of having to make cuts or changes would only mean more work for fewer. The work is only increasing.
Mhm.
And so we work very hard to try to be innovative, as most nonprofits do, of how can we think of this role in the most creative way? How can we leverage volunteers? How can we leverage practicum students? and all of the different things. But at the end of the day, we still need those subject matter experts and those people that are delivering those services. And so it has been, I think, nonstop brainstorming and just deep breaths of trying to anticipate what's to come while not knowing what's to come.
Right. And when I think of Family Scholar House, I absolutely think of highly innovative. Your team does a ton of really creative, out of the box kind of things that have pushed you to grow so quickly. And I know all the organizations here have a long history of service to Southern Indiana. So we want to continue to be able to provide high quality support to our neighbors here. So I want to be respectful of your time, but I do want to end on a positive note. We do amazing work, right? That's really the point of this conversation. So I'd love for each of you to share just something you have coming up that you're excited about for your organization or recent win. Whoever has one, the top of mind that they want to jump on, but we'll give everyone a chance.
I'm going to say our back to school event that's coming up on July the 19th. Um, a lady walked up to I was at the library at a health fair real quick, and she said, "Oh, the back to school health fair." She said, "We love coming to that." I said, "Please make sure you share the information. Here's the immunization. Here's the QR code. If you have anyone that needs a child that needs immunization, please make sure you register them." But at that event, if you guys aren't doing anything, come on down. Please share that information with your clients. We welcome them to the event. It's fun, it's nice, but it's provides a lot of resources. And with the increase in prices, food, I know we'll probably have more families coming out this year.
I'd like to share about this past Monday night, we had 16 young men and women graduate from our holistic hardware program. So this is a program that teaches life skills to help families thrive in our community, ranging from self-esteem to budgeting and everything in between. So these 16 graduates were full of hopefulness, they were full of resiliency and full of drive, and it was so rewarding to see these young men and women get excited about the future. Sometimes we forget when we're having conversations like this that we're talking about working families, we're talking about hungry kids, we're talking about the elderly, we're talking about veterans, we're talking about some of the most vulnerable people in our community. But in that community, there is so much hope and there's so much compassion and there's so much joy. And it's beautiful to see just young people get excited about the future.
Thank you, Becky. I love that.
Yes. Mine is so a few weeks ago, we celebrated our graduation celebration, which we do every year, inviting community members in. And so we had 61 credentials earned by our class of 2025. And so those are associates and bachelors and a couple masters sprinkled in. And so it's my favorite day of the year. We do a ceremony with the adults, but then at the end, the kids come in with hats that say my mom is a grad or my dad is a grad. And so it really encaptures why we do what we do. And it brings all of the hard days because we get to celebrate the hardest working people I know, which is our participants and everything that they've sacrificed and overcome to get to this moment, and then to see their kids so excited. And so that's definitely my favorite day of the year and kind of re-energizes you for the rest of the year until the next time. So super excited for our graduates.
I love how you just sprinkled in a couple master's degrees. Like that's a real casual thing, just a couple master's degrees. That's amazing. It is always so refreshing to hear all the amazing work that's going on. And I know it takes a ton of time. So thank you for making time for this discussion today and providing your perspective on the impact of federal resources here in Southern Indiana. I will share out this recording once we get it cleaned up. But thank you all so much. That was wonderful.